joint or articulation is the location at which bones connect. They are constructed to allow movement and provide mechanical support, and are classified structurally and functionally. Classification: joints are mainly classified structurally and functionally. Structural classification is determined by how the bones connect to each other, while functional classification is determined by the degree of movement between the articulating bones. In practice, there is significant overlap between the two types of classifications. Terms ending in the suffix cis are singular and refer to just one joint, while cis is the suffix for pluralization. An articulate facet is generally seen as a small joint, especially used when speaking of the joints of the ribs. Structural classification: structural classification names and divides joints according to the type of binding tissue that connects the bones to each other. There are three structural classifications of joints: fibrous joint, a joint by dense regular connective tissue that is rich in collagen fibers; cartilaginous joint, a joint by cartilage; synovial joint, a not directly joined, the bones have a synovial cavity and are united by the dense irregular connective tissue that forms the articular capsule that is normally associated with accessory ligaments. Functional classification: joints can also be classified functionally according to the type and degree of movement they allow. Synarthrosis, a permits little or no mobility. Most synarthrosis joints are fibrous joints. Amphiarthrosis, a permits slight mobility. Most amphiarthrosis joints are cartilaginous joints. Diarthrosis, a freely movable. All diarthrosis joints are synovial joints, and the terms diarthrosis and synovial joint are considered equivalent by terminologia anatomica. Diarthroses can in turn be classified into 6 groups according to the type of movement they allow: arthrodia, enarthrosis, ginglymus, rotary diarthrosis, condyloid articulation, and articulation by reciprocal reception. Joints can also be classified, according to the number of axes of movement they allow, into monoaxial, biaxial and multiaxial. Another classification is according to the degrees of freedom allowed, and distinguished between joints with 1, 2 or 3 degrees of freedom. A further classification is according to the number and shapes of the articular surfaces: flat, concave and convex surfaces. Types of articular surfaces include trochlear surfaces. Biomechanical classification: joints can also be classified based on their anatomy or on their biomechanical properties. According to the anatomic classification, joints are subdivided into simple and compound, depending on the number of bones involved, and into complex and combination joints: simple joint, 2 articulation surfaces; compound joint, 3 or more articulation surfaces; complex joint, 2 or more articulation surfaces; and an articular disc or meniscus. Anatomical: the joints may be classified anatomically into the following groups: articulations of hand, elbow joints, wrist joints, axillary articulations, sternoclavicular joints, vertebral articulations, temporomandibular joints, sacroiliac joints, hip joints, knee joints, articulations of foot, joint disorders. A joint disorder is termed an arthropathy, and when involving inflammation of one or more joints, the disorder is called an arthritis. Most joint disorders involve arthritis, but joint damage by external physical trauma is typically not termed arthritis. Arthropathies are called polyarticular when involving many joints and monticular when involving only a single joint. Arthritis is the leading cause of disability in people over the age of 55. There are many different forms of arthritis, each of which has a different cause. The most common form of arthritis, osteoarthritis, occurs following trauma to the joint, following an infection of the joint, or simply as a result of aging. Furthermore, there is emerging evidence that abnormal anatomy may contribute to early development of osteoarthritis. Other forms of arthritis are rheumatoid arthritis and psoriatic arthritis, which are autoimmune diseases in which the body is attacking itself. Septic arthritis is caused by joint infection. Gouty arthritis is caused by deposition of uric acid crystals in the joint that results in subsequent inflammation. Additionally, there is a less common form of gout that is caused by the formation of rhomboidal-shaped crystals of calcium pyrophosphate. This form of gout is known as pseudo-gout. History, etymology, joint. The English word joint is a past participle of the verb join, and can be read as joined. Joint is derived from Latin iunctus, past participle of the Latin verb iugere, join together, unite, connect, attach. In Classical Latin, a similar name, derived from the verb iugere, exists that clearly is related to the meaning of the joint in the English language. Unctura as joint is attested in the writings of Celsus and Ovidius. Celsus used besides the term unctura also articulus and rarely nudus to refer to joints. The term unctura was in Classical Latin not a very precise designation, as it could refer to all kinds of connections between bones, as the sutures of the skull were also referred to as the uncturae serrati. Ovidius refers to the knee joint as the unctura genuum and to the cervical joints as the uncturae vertices. Besides the ascribed anatomical meaning, unctura could also refer to a relationship or to consanguinity. In English, jointure and juncture are both derived from Classical Latin unctura. In the Romance languages, French jointure, Italian giuntura and Spanish juntura are used to refer to a joint, with the first similarly derived from Latin unctura. In the anatomic Latin of the Nomina Anatomica, rebaptized in 1998 as Terminologia Anatomica, numerous expressions can be found that utilize the noun junctura, including junctura osseum to refer to connection between bones, and translated as joining of bones in the English translation of the Basel Nomina Anatomica, junctura fibrosa to refer to a fibrous joint, junctura cartilaginea for a cartilaginous joint, junctura osseum thoracicae for the joints of the arms, and the junctura osseum pelvinae for the joints of the legs. Articulation. The English term articulation is derived from Latin articulatio. The usage of this term, akin to its equivalents in Romance languages, like French articulation, Spanish articulasa cubed n, Italian articulation, and Portuguese articula picavolt poundo, that are similarly derived from the same Latin word, can be considered as a barbarism, in the sense that an incorrect meaning is ascribed to this word. The term articulatio can be found in the writings of Pliny the Elder as the putting forth of new joints or knots, or could refer to a disease of the vine that the joints are cubed f the tendrils. Articulatio as articulation or joint is not attested in Classical Latin. As mentioned earlier, in Roman antiquity, various terms like unctura, nodus and articulus were used to refer to a joint or articulation. The first edition of the official Latin nomenclature, Basel Nomina Anatomica, used in 1895 the incorrect form articulatio. In the subsequent edition, authorized in 1935 in Gina, hence the name Gina Nomina Anatomica, the editor clearly objected to the use of the incorrect form articulatio and thought it was self-evident that this barbarism had to be replaced by the Classical Latin articulus. The edition of the Nomina Anatomica approved by the Nomenclature Committee in 1955 in Paris however reverted this correction to the incorrect form articulatio. In each subsequent edition, the incorrect form articulatio was favored. Although not common, English article can also be found to refer to a joint. In the Romance languages, similar words with the same meaning, like French article, also derived from Latin articulus, Spanish articulo and Italian articulo, can also be found. See also, arthrology, kinesiology, ligament, replacement joint, references, joint definition. E-Medicine Dictionary April 27, 2011. Retrieved January 27, 2012. Articulation definition. E-Medicine Dictionary October 30, 2013. Retrieved November 18, 2013. Ellis, Harold. Susan Standring. Gray, Henry David. Gray's Anatomy, The Anatomical Basis of Clinical Practice. St. Louis, Missouri, Elsevier Churchill Livingston. PA 38. ISBN A0-443-07168-3. Media Lexicon, Medical Dictionary, Articular Facet. Retrieved December 19, 2013. Foundational Model of Anatomy. Retrieved December 19, 2013. ABC Whiting, William Charles and Rugged Anatomy, Stewart Dynamic Human Anatomy, Volume 10 pages 40, Introduction to Joints, Classification by Tissue Joining Bones Anatomy Med Umich Edu. Archived from the original on June 8, 2011. Retrieved January 29, 2008 A.B. Principles of Anatomy and Physiology, 12th edition, Tortora and Erickson, Pub, Wiley & Sons, A.B. Introduction to Joints, Classification by Movement Anatomy Med Umich Edu. Archived from the original on July 18, 2011. Retrieved October 6, 2012 A. Synovial joint at Dorland's Medical Dictionary, Samuel George Morton An Illustrated System of Human Anatomy pages 119, Henry Gray Anatomy, Descriptive and Surgical pages 136, Henry Gray Anatomy, Descriptive and Surgical pages 220, ABC Platzer, Werner Color Atlas of Human Anatomy, Volume 1, pages 28, Armin S. Klikian, Shahan Sarafian's Anatomy of the Foot and Ankle, Descriptive, Topographic, Functional PA 94, Introductory Anatomy, Joints. Retrieved January 29, 2008 A. ABCDE Klein, E.A. Comprehensive Etymological Dictionary of the English Language. Dealing with the origin of words and their sense development, thus illustration the history of civilization and culture. Amsterdam, Elsevier Science BV, ABCDEFG Lewis, CT in short, CA Latin Dictionary founded on Andrews' edition of Freund's Latin Dictionary. Oxford, Clarendon Press. ABCDEFGHIJKLM Hyrel, J. Onomatologia Anatomica. Geschichte und Kritik der Anatomischen Sprache der Gegenwart. Wien, Wilhelm Bräumer 1/4 Lehr. KK Hoff und Universitätscurrency Currency NDLER. ABC Unordov, GD Terminologia Medica Polyglotta. Latinum Bulgarski Rusk English für eine Section A's Deutsch. Sophia, Editio Medicina A Fisicultura. ABC Slyersburg, A. Elsevier Euro Unregistered Trademark S Medical Dictionary in 5 languages. English American/French/Italian/Spanish and German Amsterdam New York, Elsevier Euro Unregistered Trademark S Scientific Publishing Company. ABC Gladstone, W.J. and Roche, PA Euro Unregistered Trademark Dictionnaire Anglais for une section A's des Sciences Mar Copyright Dicles A Parama Copyright Dicles English French Dictionary of Medical and Paramedical Sciences A Euro Unregistered Trademark A Euro Unregistered Trademark. Quay Copyright Beck, Edison Paris, Meloin. Car Paragraph RTING, GA Euro Unregistered Trademark Latinish Romanisches WAP Paragraph Rutabucha Euro Unregistered Trademark A Euro Unregistered Trademark. Paderborn, Verlag Ferdinandsche Paragraph Ning. ABC Dorzat, A, Dubois, J, and Mitteron, H. Nouveau Dictionnaire Copyright Etymologique et Historique A Euro Unregistered Trademark A Euro Unregistered Trademark Paris, Librairie Larousse. His, W. Die Anatomische Nomenklatur. Nomina Anatomica. Der von der Anatomischen Gesellschaft auf ihre 9. Versammlungen Basel angenommen Namen. Leipzig, Verlag Vatenkamp. ABCDKOPSCH, F. Die Nomina Anatomica des Jahres 1895 NACH der Buchstabenreihe und Gegner 1/4 Bergestalt der Nomina Anatomica des Jahres 1935. Leipzig, Georg Thiam Verlag. ABCDE Stive, H. Nomina Anatomica. Zusammengestalt von der im Jahr 1923 zur Currency HLTEN Nomenklatur Commission, unter Beere 1/4 Zeitigung der Vorzur Currency GE der Mitglieder der Anatomischen Gesellschaft, der Anatomical Society of Great Britain and Ireland, SAWI der American Association of Anatomists, a 1/4 Berper 1/4 Foot und der Specialwie der Anatomischen Gesellschaft auf der Tagung in Jena 1935 Entgo LTIG Angenomen Jena, Verlag Gustav Fischer. Barker, L.W. Anatomical Terminology with special reference to the BNA. With vocabularies in Latin and English and illustrations. Philadelphia, P. Blackistone Euro Unregistered Trademark S. Son and Company, ABC Didonia Th. T. and Crawford, GCN Anatomical Dictionary with nomenclature and explanatory notes. Oxford, Edinburgh, New York, Sydney, Braunschweig, Pergamon Press. ABC International Anatomical Nomenclature Committee. Nomina Anatomica. Amsterdam, Excerpta Medica Foundation. AB Federative International Committee on Anatomical Terminology. Terminologia Histologica. International Terms for Human Cytology and Histology. Philadelphia, New York, Buenos Aires, Hong Kong, Tokyo, Walter Kluis, Lippincott, Williams and Wilkins. ABCDEFG Foster, FD, an Illustrated Medical Dictionary. Being a dictionary of the technical terms used by writers on medicine and the collateral sciences, in the Latin, English, French, and German languages. New York, D. Appleton and Company. Schleifer, S.K. Corpus Humanum, The Human Body, Le Corps Humain, Der Menschliche Paragraphe per, Il Corpo Humano, El Cuerpo Humano, Sciaroxaowica, Mar Currency Niskokrippen, Menskroppen, IAI plus or minus I1/2 III Euro I to the first I1/2 II Florina paragraph I1/4 I plus or minus, th microwatt th. FKG. International Anatomical Nomenclature Committee. Nomina Anatomica, together with Nomina Histologica and Nomina Embryologica. Amsterdam, Oxford, Excerpta Medica. International Anatomical Nomenclature Committee. Nomina Anatomica, together with Nomina Histologica and Nomina Embryologica. Baltimore, London, Williams and Wilkins, International Anatomical Nomenclature Committee. Nomina Anatomica, together with Nomina Histologica and Nomina Embryologica. Edinburgh, Churchill Livingston. Federative Committee on Anatomical Terminology. Terminologia Anatomica. Stuttgart, Thiam, External Links, Synovial Joints Illustrations and Classification.